Ever wondered why runners and obese individuals are prone to plantar fasciitis, also known as heel spur syndrome? This common ailment is a frequent guest in the lives of often arriving uninvited and overstaying its welcome. It's a repetitive strain injury that can cause a world of discomfort and inconvenience, particularly for those who love to hit the pavement or who are carrying a little extra weight. In the next few minutes we will unravel the mystery behind this condition. But before we do that, make sure you hit that subscribe button and give us a thumbs up if you appreciate our content. Your support will help us bring you more interesting, challenging, and high-quality videos. So, let's help each other out. The mechanism of plantar fasciitis is quite straightforward. This condition is a form of repetitive strain injury that results in microtears and inflammation in the plantar fascia, which is the thick band of tissue running across the bottom of your foot, connecting your heel bone to your toes. These continuous microtears can lead to the fascia becoming inflamed, resulting in the painful condition known as plantar fasciitis. Interestingly, the occurrence of this condition tends to skew towards women, with twice as many women suffering from it compared to men. But it's not just gender that plays a role. Plantar fasciitis is also commonly seen amongst athletes, especially those who run frequently. Obesity, diabetes, and certain types of arthritis, both seronegative and seropositive, are also associated with a higher risk of developing this condition. Now that we understand what causes plantar fasciitis, let's move on to its symptoms. Plantar fasciitis presents with some distinctive clinical features. The most notable symptom is an intense pain in the morning, or when walking after a period of rest. This pain tends to subside as the patient continues to walk. The affected area, typically the sole of the foot, may also exhibit swelling and tenderness. The discomfort is often most severe at the medial calcaneal tubercle and 1 to 2 centimeters distal along the plantar fascia. Investigations into the condition usually involve plain radiographs. These images are used to rule out fractures and to detect bony exostoses or heel spurs at the insertion of the fascia into the medial calcaneal tubercle. Once diagnosed, there are several treatment options available. Treating plantar fasciitis involves a multifaceted approach. Rest, ice, and NSAIDs are often the first line of defense, complemented by steroid injections to reduce inflammation. Physiotherapy plays a crucial role, with stretching, ultrasound, and extracorporeal shockwave therapy being frequently utilized. Orthotics with a heel cup can help disperse heel strike forces. Rarely, if these measures are ineffective, endoscopic surgical release of the fascia might be considered. With proper treatment, patients can expect a significant reduction in pain and improved foot function. Plantar fasciitis can be a painful condition, but understanding its mechanism and treatment options can help manage it effectively. We've discussed its cause, signs, diagnosis, and treatment. Remember to subscribe and like the video for more content. Join our community and stay informed about various health conditions and their management.